When it comes to dry eye, it's incredibly important to get into a sustainable routine. In all the patients I've seen and the experience I have treating dry eye, the most important factor is patients finding the right routine for them. So today, what I've done is put together what I think is a really great starting point for a daily routine if you have dry eye. I found that this is helpful whether you have early, like mild dry eye, or even more advanced dry eye disease.
Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week.
You've made it to Eye School with me, Dr. D. Welcome, make yourself comfy, and let's talk about your daily dry eye routine. Before we get started, this channel is all about eye education, and I love creating this community of pupils. You can catch all my previous Eye School episodes in the playlist I've curated below, and if you came here specifically for dry eye, there's a plethora of videos already made, so I invite you to check those out. So let's take you through a day in the life of maybe a working professional with dry eye. So when you wake up in the morning, the first thing you want to do is wash your face, rinse off any residual eye ointment or crust from the nighttime, and potentially even do a warm compress and lid scrub in the morning. Then after you're done with your warm compress and lid scrub, go ahead and instill your eye drops. For breakfast, working omega-3s into your breakfast is fairly simple and can be accomplished with an omelet or egg white omelet, oatmeal, or a breakfast shake. Take any oral medication your doctor has prescribed with your breakfast, so doxycycline or fish oil that you're taking for your dry eye, you do want to take those things with food. And when you hop in the car to go to work, make sure to point those air vents in your car away from your face as you head off. So once you're at work and getting comfortable, in the mid-morning, I want you to take a little break and stop to instill artificial tears. Now there's a couple great ways to do this. Of course, everybody knows about eye drops, but one of my favorites for when I'm working is actually an eye spray. So you can do this either when you're at your desk or when you run to the break room for your second cup of coffee. This will make sure your eyes aren't feeling terrible before lunchtime. Now is also a great time to snack on some walnuts and dried fruit. Also, if you haven't already, go ahead and turn on your humidifier next to your desk. If you don't have one of those, definitely think about getting one. For lunch, you can go ahead and do another artificial tear. Your eyes may not feel bad yet, but habit stacking and using drops proactively instead of reactively are going to set you up for success. Eat a lunch packed with omega-3s, like a salmon dish or a spinach salad with walnut oil and balsamic vinegar. Consider a midday warm compress during your lunch break if you have severe meibomian gland dysfunction. If you don't know what that is, definitely check out my video about warm compresses here to help find one that works for you, especially if you have to leave one in your desk drawer at work. And also look at my video about meibomian glands 101 so you know what you're treating. Putting in your artificial tear after the warm compress as opposed to before may help flush the oil from your ocular surface. In the mid-afternoon, do another artificial tear to keep that ocular surface lubricated while you clear out your inbox. Your eyes will thank you later. Need a little mid-afternoon snack? Grab a yogurt and top it with chia seeds and fruit. At the end of your workday, do one more artificial tear before the drive home and pop on your protective sunglasses as you head out the door. If your doctor has you taking oral medications twice a day, you're going to want to go ahead and take those when you get home with dinner. Some of my favorite omega-3 rich dinners are kale and white bean soup, or you could do grilled trout with roasted Brussels sprouts, or even riced cauliflower. Perhaps you could try a fruit and buckwheat crumble for dessert. Once it's bedtime, this is critical. Make sure to wash your face and pop on your warm compress mask and relax a little bit. You're gonna do your eyelid massage with that lid scrub. So you're gonna wanna take the wipe from your lid scrub and wrap it around your finger, massage down on the top lid 10 times and up on the bottom lid 10 times. After that, you can apply any skincare you'd prefer and instill any medicated drops you might take, like Restasis. Make sure to turn off that ceiling fan before bed, turn on your humidifier, and instill a nighttime ointment if your doctor has prescribed it. Just make sure that that nighttime ointment is about 5 minutes after your medicated drop, and then you can throw on your protective sleep mask if you prefer. If you've got specific questions about a nighttime routine, I actually made a whole video about the nighttime routine that you can see right here. As you can see, creating habits throughout the day will really make an impact on your overall, how your eyes feel, how your dry eye looks. And we're really trying as eye doctors to help you get the right tools in your toolbox to treat your dry eye and the right habit stacking and the right daily routine to help your eyes feel their best on a day-to-day basis. What I went through today is just a sample routine. Some of it may seem silly to you or not like it's a good fit for your particular life, but that's the thing about dry eye, is that each of us have to find the way that the puzzle pieces fit together for us. And so I hope that this was helpful to you as a place to start for an example of a dry eye routine. That is it for today's iSchool lesson. I will see you next time. Class is dismissed.